Many times, trauma patients arrive in the emergency department with a normal CT scan of the head. But sometimes they usually have these ecchymotic patches by the side of the neck, which is called as a seatbelt sign. Whenever we see the seatbelt sign, we should be asking ourselves whether we are missing out on any blunt carotid injury. Blunt carotid injury occurs because of the hyperextension or rotation of the neck over cervical vertebra, especially segment C1 to C3 cervical spine. Because of hyperextension, the stretching of the carotid artery occurs over the cervical vertebra. The grading of cervical artery injury is important for deciding its management. The grading is called as the Biffle grading. If luminal irregularity or dissection is present, which is causing less than 25% of the narrowing, then it is grade 1 injury. If dissection is present or intramural hematoma is present, which causes more than 25% of the luminal narrowing, then it is grade 2 injury. Grade 3 injury is nothing but a pseudoaneurysm, and a grade 4 injury is an occlusion. Grade 5 injury is called as a transection or a free extravasation. While assessing these patients, we have to look for the Horner syndrome, which consists of ptosis, anhidrosis, and meiosis. This happens due to the injury to the sympathetic plexus, which runs over the carotid artery. For the management of grade 1 and grade 2 injury, we require aspirin of about 325 mg per day. Aspirin has the same efficiency as that of heparin. Grade 3 injury requires endovascular stenting. The grade 4 injury requires prevention of clot propagation, as these patients usually have a high risk of developing a stroke. Grade 5 injury, which is transection, is an emergency and requires urgent surgery. Lastly, we need to know that even if carotid artery injury is not evident, there are certain cases in which we have to rule them out by doing a CT angiography. This is called as a Denver's criteria for ruling out blunt injury to carotid artery. The criteria includes Lee-Fort type 2 and type 3 fractures, basilar fractures, especially if the fracture line runs through the carotid canal, and a cervical spine subluxation injury.